What happens if a baby gets burned? What do you do for this burnt baby? And do babies heal quick enough from these burns? Hello and welcome. I'm your host, Dr. Mosam Tombeni. Signing with us is Tepo Maseko, and the feeder interpreter is Ntabiseng Ndlovu. On Vital Signs, we focus on childhood burns. South Africa has dedicated May as Burns Awareness Month and focuses specifically between the 6th and the 12th of May on National Burns Awareness Week. The goal of National Burns Awareness Week and month is to share important information on burns awareness as well as safety. Coming up on the program, producer Zama Buthelezi visited the Chris Hani Baragwanath Hospital state-of-the-art unit, and this, of course, the burns unit, and she spoke to the operations manager, as well as a parent whose child suffered severe burns and had to be hospitalized. We'll speak to the head of the burns unit at Chris Hani Baragwanath Academic Hospital about the common causes, impact, as well as the treatment of childhood burns, and we'll speak to the communications officer at ER24 about what to do and what not to do if someone sustains a burn, as well as looking at safety as well as prevention. Remember that you can be part of the show by asking the guests that we'll have on the show the questions that you have on your mind, or simply share your view on what we're discussing today. The number to call is 011-714-5861 or 011-714-5877. Also on social media, you can share your thoughts with us. The Twitter handle is at SABC Vital Signs or Facebook SABC Vital Signs. The show will continue right after this ad break. Welcome back to Vital Signs. Now, more than 250 adults and 500 children with severe burns are admitted to Chris Hani Baragwanath Academic Hospital annually from Soweto, the surrounding areas, and the continent. Now, due to the highly specialized service that is offered at the burns unit. Each year, thousands of people suffer burns injuries. While some burns can be minor, others can be devastating, causing permanent disfigurement, damage, as well as death. Zama Buthelezi spoke to Nurse Ellen Mudau, who's the operations manager at Chris Hani Baragwanath's burn unit. Let's have a listen to the interview.
The winter season is upon us, and with looming load shedding, many people will have to resort to using candles for lights, paraffin, or make fires for cooking and keeping warm. This over the years has posed danger to children who are seen at the Chris Hani Baragwanath burns unit. Sister Ellen Mudau, who is the operational manager pediatric burns unit, talks to us about how busy they are.
Burns unit is very busy in winter season, more especially because it's where it's very cold and people use things like heaters, water, stove, mbaula in Lokshini to warm themselves. So the kids become neglected sometimes, then they got burnt through hot water and fire.
The extent of burns differs with each case, according to Sister Mudau.
The admission criteria that we use 2 to 100%. Here we don't discriminate in peace burns. So mostly if kids are age less than 1 year and are more than 10%, we admit in ICU. So they will be in ICU side, and the other ones, they will be in the ward side.
But what are the most common reasons behind the pediatric burns?
It's due to negligence because we are not supervising the babies at home. So if you are cooking, if you're boiling water, the kids are left unattended. So secondly, it's pulling the kettles. Our kettles and pots are not put at the higher rate where the child cannot reach. So they pull those hot water kettles, and mostly if we boil water, after using it, we leave the hot water in the kettle and go. When the child comes there, it will pull and get burnt. And another thing then is when we bathe the babies, we start with hot water. So going there to fetch cold water, when you come back, the child is inside there. So get the bumps and the legs are bent.
Chris Hani Baragwanath burns unit is the state-of-the-art facility. So what's the success rate of the treatment?
The success rate is 75%, where to reach 100%, 5% in our unit. It's according to the season, as I'm saying, mostly in winter and during December, because there are crickets and the stuff, and sometimes during school holiday. So we get more percentage of burns. So then 5% is the death rate. So they die by 5%. Then 20% we discharge home for follow-up.
What are complications as a result of the severity of burns?
The first one is contractures, because you know when you are bent, it's not easy for you to use the limb, the hand which is bent. So they tend up to not work straight, so there will be contractures then. So which is a long way process, because it needs to be healed before we can come and release and repair that thing. So then the second one is the scars. So as I said, during fire, they will be bent in the face. So the scar is not easy to go completely, considering the age. If the child is still young, Boma months, at least you can heal completely. But others, if they are 10 years old, it's difficult for the scar to heal. Then deformity again, you see the limbs. I told you about the crickets and the electric one. So we end up amputating the limb.
How are complications as a result of burn injuries minimized at this facility?
Mostly, we make sure that we ambulate them early ambulation, so that we can prevent this. So if they go out of the bed early and exercise, we minimize contraction and deformities. And then we have physios who help us with exercises and teaching how to use that limb which is affected. We have OT, occupational therapists, who come and make splint, so that, because I said it's not easy to use the limb which is affected, so they make splint so that they can use that limb or that. And we use also skin graft so that the skin can be replaced early. The wound can heal faster.
Is the burns unit ready for winter and the holidays?
Staff-wise, we are ready. Doctors are here, and the cubicles are ready, because we created even the step-down ward, because we are aware that our unit doesn't cater a lot of people, because it's only 26 beds, but we are ready for that.
After the break, we speak to Professor Muganza, the head of the burns unit at Chris Hani Baragwanath Academic Hospital, about childhood burns. Stay with us. Welcome back to Vital Signs. I'm Dr. Musam Tombin, and today we're talking about burns. If you're at home and have had an experience with respect to burns, please get in touch with us. We'd like to hear your story. And if you have any questions, of course, our guests will be available to take any questions that you have on your mind. Now, every year, thousands of children are admitted to hospital with severe burn injuries. Most burns occur in and around the home. Now, the child can be burnt at an instant. One mistake, one careless moment may lead to a life-changing injury that will affect them even in adulthood. Now, children are curious and they like to explore their surroundings, and they don't know where the hot water is actually hot, and that hot drink can actually cause burns. And today we'll put a special focus on childhood burns with our guest, Professor Muganza, who is the head of the burns unit at Chris Hani Baragwanath Academic Hospital. Good day, Prof. Thank you so much for joining us.
Good morning. Thank you.
Let's get into it. A lot of people speak to the idea of burns, and I think in our societies and the places that we live, and the news, when we see on a daily basis, there's always something that is burnt, or an informal settlement or shacks, or whatever it might have been, where people end up getting injured. So medically speaking, when we say someone has got a burn injury, why is it important to highlight this?
Yeah, it's very important to highlight the burns because as you know, you cannot live without a skin, but you can live without a kidney. So the skin is a very important organ for us. It's the barrier. It's our defense for any infection. So if your skin is damaged due to burns, of course, you're going to get infection and other complications. That's why it's very important to treat it properly.
So a lot of us, I think, have experienced burns in some way, shape or form. You know, you drank tea that was a little bit too hot and now your tongue is a little bit sore. You've touched the surface that was hot. But with respect to medical burns, how do we grade the burns and what do they actually look like?
Yeah, no, thank you very much. It's very important to grade the burns. Most of the time, if you have burns due to hot water, you have what we call the superficial burns. And if it's due to fire, most of the time it goes very deep. And then you get what we call the full thickness burns. So the treatment is totally different. But I want to put it in a very simple way. You know, if you've got, let's say, the house is burned, it's just the roof is gone, that's superficial. If the roof and the ceiling gone, then you have like a second-degree burns. And then if everything is gone, the roof, the ceiling, and some of the floor, then you have the third-degree burns. That's more severe.
So if I take my hand and I touch a hot kettle today, of course I've been burnt, but that, as you're describing, becomes a superficial burn, and most of the time won't necessarily leave a mark. So are the burns that are taken more seriously those that leave marks and have, like you're saying, taken through full thickness burns?
Yeah, it depends on the temperature at the time that you put your hand on, and it depends as well on the timing. If you left the hand for a long period of time, then it will go more deeper. And if the temperature has been very high, of course, it will be more deeper. But sometimes you have these superficial burns due to just the sunlight. And that's not very deep, but it can be very, very painful because it affected the nerves on the surface.
So let's talk about childhood burns. Your unit at Chris Hani Baragwanath sees a lot of these per year. In terms of numbers, just from a general scope of, you know, what you see and the cases that you get every year, how busy is the burns unit?
Yeah, the burns unit is always very busy. In average, we have 250 patients admitted to the burn unit, adults per year, and around 500 children.
Sure.
But that doesn't mean that those are the patients that we have to admit only at the burns unit. There are many patients that do not come to the burns unit because of limiting bed facility. So some of those patients are admitted in trauma or in a general ward because we don't have bed. And many patients, sometimes they don't come to us because we are full. And especially now that winter starting, it's a very, very busy time.
What contributes to this increase in number during seasons like winter? And I think in the interview that we had with the operations manager, during school holidays and periods where children are generally idle or around the home?
I think that Sister Mundau said it very clear. I think during the winter, first of all, we know that it's very cold, and then everyone wants to warm up. And people want to use hot water to drink, tea, and so on. And some negligence as well can come when it regards to kids. They try to pull the kettle from the top. But beyond that, you have as well fire that can cause burns in children. And that's more severe because it affects the lungs as well.
So who gets admitted at your facility? I think a lot of the time we speak to burns, and I think you've mentioned that a lot of people get burnt at home and then start self-treating and looking at how to, you know, manage that burn themselves. But what quantifies or qualifies someone getting into the facility to get admitted? How bad do your burns have to be for children specifically?
Yes. As I said earlier, first of all, you must know that if the child was burned with fire, flame, there'll be some smoke product that the child can inhale. So you have what we call a smoke injury. Automatically, even if the wounds are not deep or large, such patient with that smoke injury to the lungs must be admitted. Then you look at the size. We usually say that if it's more than 10% of the size, you must admit the child. And we know as well some special area like the face, like the joint, need attention, because if you don't admit those patients to a specialized facility, they do get complications.
So you've spoken to the idea of percentages, and I think Nurse Mdau also said that, but why is it important to qualify what a percentage means and what requires admission? How do you explain these percentages?
No, thank you. The size of burns matter. It's not only the size, it's as well the deepness of the burns.
Okay.
Now, when it comes to the size, if the wound is very large, it's more than, let's say, 15%, 20%, then there is a risk of the burns to create more other injuries in other organs, even if they were not directly involved by burns, like the kidney, like the lungs, and bowel. So it's very important to classify the size of burns. So the extent of burns is one of the most important factor that decide the outcome of the child or the patient with burns.
Now, importantly, a lot of children find themselves, getting these injuries at this point in time. And of course, there are a number of factors that contribute to the child getting admitted into hospital. But why is it important for parents to know that once a child is burnt, even if they don't know what percentage it is at the time, that they go to a facility to have the child get managed or seen at least?
Yes, and I would say that majority of burns actually are treated by the GP. And the GP will know which patient to be transferred to the burns facility. So a small burns can be safely treated as an outpatient from home, but you must get advice from a medical personnel what to use and what not to use.
What to use and what not to use, I think we'll get into a little bit later on when we chat around treatments. But commonly, what we also find during all these situations where people get burnt, you've mentioned the fires, you've mentioned the hot water, is this idea of chemical burns. Tell us more about chemical burns and what that actually means.
Yes, chemical burns is one of the severe burns that we do see. It can be acid, it can be other products. And what is important with chemical burns is that it can go very deep to the wound, and it can continue to damage the skin even after a few hours of contact with the chemical. So we always look at chemical burns as severe burns, and even if it's small burns, it's one of the criteria of admission to the burns unit. And while you're talking about the chemical burns, I look at the electrical burns. The same thing. Electrical burns are more severe, and they need to be admitted by, to the burns unit.
So tell us a bit more about electrical burns. I think with the situation that we find ourselves in, where some communities have, these connections that might not necessarily be very legal, or just a child in the home, playing with the plug that's plugged in and then electrocuting themselves. Why are electrical burns important to note, and why are you saying they require admission over a smaller area burn?
Yeah, thank you. It's very important. We're starting to see more electrical burns nowadays. And one of the special things with electrical burns is that besides the skin damage, it can affect the heart. So a patient can have with what we call arrhythmia. So the heartbeat is not regular anymore, and that can have any complication. And many of these patients sometimes they die on the scene. Besides that, the electrical burns will affect the deep muscles, and the breakdown of that muscles can affect the kidney. And sometimes they do have what we call renal failure, kidney failure. And those patients need a lot of fluid replacement so that we can prevent the kidney failure. That's the most important thing to know about electrical burn.
Well, thanks, Prof. We're going to continue our discussion a little bit later on. Of course, we're talking about burns, and that is Prof. Muganza, who's the head of the burns unit at Chris Hani Baragwanath Hospital. Remember that you can be part of the show by asking the guests the questions that you have in your mind. Simply share your view with us on what we're discussing. The number to call, 011-714-5861 or 011-714-5877. After the break, we speak to Russell Mehring, the communications officer at ER24, about what to do and what not to do if someone sustains a burn. Stay with us. Welcome back to Vital Signs. A child's skin is thinner than that of an adult. That makes them more susceptible to harsher burns, and they have long-term impacts. Now, burn victims face prolonged and painful treatments. In recent cases, in many cases, burn victims have physical disabilities and, of course, are scarred for life. Childless adults, of course, or careless adults rather, put children in danger, and experts warn that everyone should be aware, take care, and know how to prevent burn accidents. Sababuteleza spoke to Jamil Holmes, a parent whose child suffered severe burns and had to be hospitalized. Let's listen to the story.
Jamil Holmes from Springs' 7-year-old daughter Asiya is one of many children who are patients at Chris Hani Burns unit. He takes us to the day his daughter got burned.
It was about last year, this same month. They were playing in the backyard with their cousins. And somehow they found a lighter or something, so they wanted to light the lighter, you know. And because her hand got a little bit sore, injured, when lighting the lighter, so she took a dress and then she wanted to ignite the lighter. So her dress caught fire, and then her whole body got, like, her upper body got on fire, like.
There are many remedies that people use at home immediately after burns that experts warn against. Was it the case with Asiya?
What she did is she immediately ran to the shower, and she opened the shower and she put her under the cold water as such. So what in the shower, she was standing and trying to cool down the body as such. But the skin also, she saw skin coming off also, so immediately she contacted a friend and neighbor and then went to the hospital.
How bad were Asiya's burns?
When we went to Far East Hospital, it was at night, so the doctors there, they couldn't really see how far it is, but they said it was about 35%. So they had to send her to Baragwana Hospital, because I think after 30% they have to transfer the site. And then when we came here, it was about 30%, 35% burn on the body.
Holmes talked to us about the treatment his daughter received and continued to receive at Chris Hani Baragwanath Burns unit a year later.
The treatment here is it's assisting us in a way, like, you know, we like you say, they did some skin graft and whatever we get from here, it's really helping us and assisting us in terms of healing. It makes it just easier for us also, and also the advice that the doctors give us here also, we always adhere to the advice, and that also assists us very, very, very much, you know? So we are thankful for the doctors this side here also, and also for the treatment that we are getting from the side.
According to Holmes, Asiya's accident had a huge impact on the family.
On the family as such, my wife especially, it does take a little bit, it's very emotional also, because now it's also a year also, and this actually just happened after one of my daughters also got sick, and she passed away. So just after that, this happened now. So it's very, very emotional for us, very stressful for us in a sense, like, it takes some toll, on our bodies and our physical appearance and our emotional also, but we just have to be strong for her, like, for example, I have to come this side normally, and then at home the wife will be assisting her, dressing her, and so both of us, it does take some toll on us.
Is enough being done in society to educate children about burns?
To a certain extent, yes, but we can do much better, to prevent all this. Like, for example, in her case, I mean, the lighter was just lying around there, and she picked up as a child. Normally, they will do it in experiment, like. So I think there is more that we as parents can do to prevent things like this happening.
What to do and what not to do if someone has a burn injury with cold winter weather coming in all kinds of directions. And we know what that means, that in poor communities in particular, open flames will lead to burn injuries. Now, here are some tips that can help you with such cases. We've got ER24's Communication Officer, Russell Mehring, with us. Russell, Mr. Mehring, thank you so much for joining us today.
Thank you very much for having me, Doctor.
Good. So you guys are a service provider that goes out in communities and assists for all sorts of incidences and accidents and cases such as that. But in winter particularly, you deal with an influx or an increase in the number of different kind of problems and incidences. And this, of course, becomes burns. So let's chat around this idea of burns and what happens. So commonly, what is the typical call you get about a burns patient?
Well, especially about burns, especially during the winter periods, we are obviously getting calls that children have sustained quite serious burns, whether it's with hot water or any heating devices, whether it's heaters or open fires, things like that. Obviously, with house fires, we are getting quite serious thermal burns. And every now and then we do attend to incidents where whether it's children or adults being burnt by chemicals as well. So those are, can be quite serious and even life-threatening.
The stories that generally follow a call or precede a call, what do those sound like? Is it the typical, a child was playing unattended and such happened? What are the stories that you normally hear?
A lot of the calls that we do attend to do involve children that have sustained, whether it's a partial to a full thickness burn. A lot of it is negligence as well, where someone wasn't monitoring the child at all times. And a lot of these can be with whether the family was boiling hot water on the stove and left the handle over the counter where the child can reach it, or a child playing with some sort of heating device, whether it be matches, a lighter, or even a stove. So these can obviously be very, very serious. And a lot of these injuries can be mitigated by obviously parents or a guardian or even a teacher, whatever the case may be, just monitoring the child.
Now, a lot of the time people are faced with this debate in their heads when a burn has just happened. Do I take this child, put them in the nearest vehicle that we can find and drive to hospital to be attended to, or do we call an ambulance? What do you suggest people do?
I think it is always better to err on the side of caution and call the emergency services, call an ambulance, and get the child proper treatments. Depending on the area and the location, sometimes it is a bit quicker to take the child to a hospital privately if you are close enough. Especially with the more serious burns, and as the professor was saying earlier, with your inhalation burns, this requires immediate advanced life support care, which honestly you won't be able to do en route to hospital while you're driving your child or a loved one or a friend or whatever the case may be. So I always prefer to say, err on the side of caution and get the emergency services to where the patient is so that they can properly treat it.
Are there things that can be done whilst we either wait for emergency services to make our way to us when someone has gotten burnt, or we're trying to, come up with some transport to get us to a facility in terms of treatment? Should we be taking milk and putting it on the burn? Should we be putting ice on the burn? What should we be doing?
See, there's so many old wives' tales on what to do, including butter, zambak, some milk, ice. All of these are obviously not to be done at all times. One of the first things that we need to do with any burn injuries, whether it's a chemical, electrical, thermal, is cool the burning process. So put the affected area under cool running water for some time, just to obviously cool the area. Anything that other than that we put on, whether it's ice or butter or any other products, can actually damage and cause more harm to the skin. Once we have cooled the affected area with cool running water, this is when we apply a moist, sterile dressing to the area. If you don't have some sort of burn dressing, a moist bandage around the area to keep it clean and as clean as possible would be beneficial. And from there, getting that person off to the closest appropriate hospital.
In cases where someone reports a fire, there are things that should and shouldn't be done. So as emergency medical services, of course, sometimes you get on the phone with people and you tell them to do certain things. So a typical call or someone calling the emergency services, what would you tell them in that acute setting?
Well, it all depends, especially with burns. So all of our call center is medically qualified and we are able to offer guidance over the phone. So in case of a child being burned, we can offer guidance and say, okay, as we said, cool the burning area, under cold running water, apply a moist dressing. Obviously, if it is a house fire, we get the City of Johannesburg EMS on scene and fire services on scene, things like that. And we would dispatch the necessary resources to the scene and provide care over the phone and say, this is what needs to be done. If it is a superficial burn, rather than sending an ambulance, we could say, this is not as serious. You can seek private transport to a hospital, or if you would like an ambulance to come out. So there are various factors that can affect what would happen in these situations.
The idea of special areas was brought up by the prof, where certain areas on the body require special attention. So in the instance of having a burn that isn't, for instance, a burn from a fire, but is more chemical and is in a special area, such as the eyes and things such as that, what happens at that point in time? What needs to happen with the person that's either calling you or someone that's watching now that may find themselves in a situation where they need to act if a chemical burn has started?
Absolutely. Well, the professor was 100% correct, and saying that chemical burns are obviously very, very serious and need to be treated immediately. Even with a minor burn, they can burn longer and deeper and cause more severe harm. So one of the first things we need to do works exactly the same as any other burn. You need to cool the burning area, or you need to remove that chemical off under cool running water. And once that has been done, the area needs to be properly treated and dressed, and that patient needs to get to a hospital. Because as we said, if that chemical is not washed off, especially in the eyes, for example, can lead to serious injury, loss of sight, and things like that. So let's look at the eye injury, for example. Cool running water as much as possible for at least 5 to 10 minutes to get all the chemical out of that. From there, bandage the eyes closed and get the person off to hospital as quickly as possible, where further advanced treatment can be taken, and hopefully the damage is not long lasting.
Preventative measures are always preached on, saying that, you know, it's always better and will always do better if the incident doesn't have to take place in any case. But how do we prepare ourselves in our individual homes to make sure that we don't find ourselves having chemical, electrical, as well as fire burns?
Absolutely. Prevention is better than cure. So in cases around the home, you should always be prepared. Purchasing a fire extinguisher from your local hardware is relatively inexpensive and only needs to be serviced once a year. So having a small fire extinguisher at home, if you can't do that for a case, in case, you can have a bucket of sand, a large bottle of water, and that can actually help should a fire break out or something happen, that you can immediately fight the fire. Obviously making sure, for electrical burns, making sure that all your plugs are covered and that kids can't get to them. Anything like matches, lighters, candles should be kept out of reach of children. And also informing them and educating them about the things that can cause serious harm to them. So heaters, lighters, and things like that. I think education is a big part and forms a big part of the prevention.
I know you guys won't necessarily have a lot of follow-up with the patients because you're first responders in most cases, but from your experience with burns patients, what do those outcomes generally look like?
There are instances where we do follow up with the patients, and I think as long as you follow the general guidelines of cooling the burn, applying moist dressing, and getting off to the hospital, rather err on the side of caution and speak to a specialist or get to the hospital, you can mitigate a lot of the risk and a lot of the damage that has been caused. If you generally leave it, can get worse, and as the nurse said and as the professor said, that can even lead to amputation of some of the limbs. So things where people have taken the necessary precautions or have taken the necessary treatments, there is generally a good turnaround.
Generally a good turnaround. Well, Mr. Mehring, thank you so much for joining us. And just before you leave, one more question. This is about first aid kits. I know a lot of people will speak to the idea of first aid kit, but what does a basic first aid kit look like for someone at home?
They vary, but a lot of them have your personal protective equipment. So this could be your CPR mouthpiece, gloves and things like that. You would have your wound dressings for general bleeding and things like that. And all of them should have some sort of burn dressing. Obviously, this can be used for your electrical, chemical, as well as your thermal burns. So they vary in size and they can be purchased from most of your pharmacies. Some hardware stores have them. And it is absolutely imperative that every household has a basic first aid kit to treat any emergencies, especially burns.
Thank you so much for joining us. Words from Mr. Mehring saying it is very important for each household to have their own first aid kit. or a version of it. The important thing here, like I said, is that there are different kinds of first aid kits that you can use, but they're going to be very important should you find yourself in a situation where you actually need to help someone out. When the next door neighbor has a burn and doesn't have a kit, you could actually be the person that will assist them. But very importantly, cooling the wound more than anything else. If you do experience a burn, run it under cold water for some time until you can get help or get to help. That, of course, was Russell Mayring, Communications Officer at ER24. After the break, we continue our discussion with Professor Muganza, the head of the burns unit at Chris Hani Baragwanath Academic Hospital, about childhood burns. Welcome back to Vital Signs. As South Africans face the threat of more load shedding, these power cuts may increase electrical fire hazards. Besides this, many families will have to resort to using gas stoves and paraffin to cook and light their homes. Now, these may pose huge risks for some, resulting in childhood burns. And to talk to us more about childhood burns and the treatment of that, we are joined by Professor Muganza, the head of the burns unit at Chris Hani Baragwanath Academic Hospital. Prof, thank you so much for coming back. Let's continue our discussion. In the first bit, I think we highlighted what burns are, why importantly we need to make sure that children and I guess people in general do not find themselves exposed to potentially getting burnt. But I want to look at the idea of treatment. Now, you've given us a criteria that highlights what would require someone getting admitted to hospital. I think we'll look at that a little bit later on. How do we treat these burns at home? So this is for the patient that comes in with a, I guess, less than 10% of their body has been burnt. They're found in a casualty or the GP's office, and they've got this burn, which is not necessarily a full thickness burn, but there's a burn that can be treated outside the hospital. How do we treat this patient?
Thank you. There are some emergencies things that we need to do. One is to make sure that your patient doesn't have enough fluid, water in the body, because once you lose the skin, then you start losing the water. Mm-hmm. So we'll make sure that you put up a good line and start replacing that loss of fluid, of water from the body. The second thing, once the patient comes, you must make sure that the airway is well open. As I said, you can have what we call smoke injury. Most of the time, it creates swelling of the upper airway, and that can obstruct the airway, and someone can stop breathing. So you must make sure that this is not the case, and then if it's the case, you must quick put a tube in the throat so that you can help the patient to get enough oxygen. And the third important thing that we do is to make sure that you prevent infection, because infection is one of the major causes of mortality with burns.
So these three things, after they've been highlighted, and this is a case, for instance, of a superficial burn that can be treated at home, how does one manage a simple, low percentage burn at home in terms of the parents or the guardians that will be looking after the child?
Yes, as Russell mentioned before, just avoid those things he said you shouldn't put on the wound. But most important is to prevent infection. So you need to put up some kind of dressing. And those dressing are there to prevent the infection to come from outside and invade the body. Most important is the pain. Those superficial burns are very, very painful. So you need to get some kind of painkillers. Paracetamol is good. And in some instances, with the GP advice, you can get some anti-inflammatory like ibuprofen just for a short period of time. But most important, you must do as well, because people, what they do, they try to put a bandage around let's say the limb. But you must put the bandage not too tight, because if you put it too tight, with the swelling of the limb that can happen after a few hours, it can actually create a more compartment, we call it compartment. It means that it's too tight, and then there's been no circulation, and that can affect the distal part of the limb.
Now, a lot of people, and what you've mentioned, highlights the importance of keeping the wound clean. That, of course, means at the site where the wound is, you'd use things to clean the wound. Is stuff such as those antiseptic creams and things such as that good to use on superficial and, I guess, maybe partial thickness burns?
Yes, as it was mentioned before by Russell, you need to get some of those ingredient into your house. You can get them from some of the pharmacies. But if you don't have it, what you have to do is just to get a clean cloth that you can put around the skin, and while waiting for the paramedics or while you're taking the patient to a GP, something clean, it is acceptable. And you wrap it, but avoid again what has been said, put there the eggs or toothpaste and anything that can damage further the wound.
So let's move on to those patients that you would generally then have to manage in a hospital setting. These are the patients that are severely burned, that have got more than 10% burns, as you've highlighted in the kiddies. How do you treat these patients in hospital? And generally, how long are these patients in hospital for?
Yes. So what we said, after those emergencies measures, protect the airway, give fluid, and then put a dressing to prevent infection, then you have to deal with the wound itself. So you want the wound to heal as soon as possible, because burns is a disease of the skin. So the sooner you heal the wound, then you're going to prevent all other infection. And for the deep wound, it's not going to heal by itself. You have to go and remove that dead tissue, and then you can put maybe a temporarily kind of a skin substitute on the wound. But in many situations, we have to do a skin transplantation, which means that you take the skin from one side of the body and then you cover on the wound. That's very, very important. Of course, there are other measures that you have to do for patient with major burns. I don't know if you want me to go in that.
Of course, Prof, go ahead.
Because, you know, burns is a multidisciplinary treatment. Those patients, because of large burns, they lose energy, then you need to give them food. So you must start to feed them as soon as possible. Usually we put the tube into the stomach so that we can start to feed those patients. The second is those patients with signs of infection, then we will start the antibiotics. But usually we don't give antibiotics from the start. We only wait when there is an infection.
Okay.
And very important as well is to look at all other allied personnel, medical personnel, like the physiotherapists, you know, the occupational therapists, the speech therapists, all of them will be involved.
So I want to highlight this importance of having occupational therapists. I think a couple of weeks back we had an episode where we were discussing the importance of occupational therapy. But in burns, what role do the occupational therapists have?
Oh, yes. You have to make sure that the, let's say, the hand function are maintained, and after the acute phase, patient can still use his hand. So those occupational therapists are trained to keep the function, at least to preserve the function of the wound. It's very, very important, and they work together with the physiotherapist to make sure that there are no contractures. If it has been mentioned, with contractures, it means that you have got deformities, then you can't function. One other part is very important, as it has been mentioned, is the psychologist. It's very important to involve the psychologist a little bit earlier, because this will affect the patient and the parents. You need some kind of counseling to the parents as well. But I can tell you as well, the psychologist sometimes has to intervene for doctors as well, because and nurses, because sometimes seeing too many burns can affect as well your morale. So you need to get a psychologist to support what you are doing.
And Prof, if we look at this idea, and you spoke to it, the skin transplant idea, you've mentioned that you'd remove skin from one area of the body to another area that's just been burnt. To someone that's sitting at home, that probably sounds confusing, saying, well, you're just going to create the same problem elsewhere. What goes into a skin transplant?
Yes, that's a very important question. When you take the skin from one part of the body, you're going to put it on the deep wound on the other side. There are machines, we call it dermatomes. So you have to use that one to take a very superficial skin, which you're going to apply on the deep wound. So the rest of the body where you remove the skin, you'll have a wound, but it would be superficial. And most of the time it can heal within 7 days to 14 days. And you have to put a special dressing. And usually it will heal without major complications. And sometimes in the large burns, what we do, you'll use the skin on that part of the body, you put on the deep side, and then later on, after maybe 3 weeks, if patient had a very extensive burns, large burns, you're going to go again on the same side, because the wound after 3 weeks will heal, and then you can again harvest the skin from that part. Yes.
Thank you so much, Prof, for joining us today and really giving us the insights that you have with respect to burns and why it's so important to look after and look out for burns. And of course, importantly, to prevent burns from happening. Such important information that's been highlighted as we make our way into the winter season, where a lot of people find themselves using fossil fuels to start fires, where children will be on school holidays, and so much more. Thank you so much for joining us, and thank you to our guests for participating in today's show. And I hope you walk away with the nuggets of information from what we've given you. Continue to be safe. Remember that the pandemic is still around. Look after yourself, play safe, and let's protect each other. From me, Dr. Musa Mtombeni, it's Vital Signs.